What has TMA done for you lately? TMA's Darren Whitehurst and Brent Annear discuss key 2015 legislative wins for Texas physicians.
I think it has been a very good legislative session. The legislature moved the drug monitoring system out of the Department of Public Safety and moved it over to the Pharmacy Board, and we eliminated the controlled substances registration process that physicians have to go through. Again, I think that will be both a small financial benefit to the physicians, but also eliminating the hoops that they were having to jump through at DPS. And we also had legislation on insurance cards relating to plans that are sold under the Affordable Care Act. The qualified health plans would require the notification to the physician and their practices on the card that says that that person participates in a qualified health plan. Because what we're finding to some extent is that these patients don't pay their premium, they lose their coverage. They lose their coverage for an entire year, and if the doctor provides services during those 90 days, they can have their payments recouped by the insurance company. So it's a bad deal all around, both for the patient and the physician. The legislature eliminated the occupations tax. And whether or not doctors know it or not, is that they're paying $200 a year in occupation tax for the privilege of practicing in the state of Texas. That was eliminated. There was an increase of about $50 million in women's health services, about $80 million in mental health services, and then $20 million for surveillance for Ebola and other infectious diseases, and then finally about $11 million for tobacco cessation. Had a bill on e-cigarettes to limit their sale to minors that felt very positive about. On the immunization record side, required MTRAC to keep records. They were destroying records when the child turned 18 if they didn't opt into the system proactively. This basically moves it up to the age of 26. We did see progress on a number of fronts, starting with graduate medical education. The state made a significant investment of close to $60 million. It's actually about $53 million. The Senate proposal had 60, so they used 53. The other $7 million were used to improve the family medicine residency programs and also to restart the preceptorship program. So again, my hat's off to the physicians that took time away from their practice to come down here for First Tuesdays, to the Alliance members who did the same, to the doctors who testified. Again, it's beyond words, my expression of gratitude, because it takes a village to get this legislative program that we have. There is not a single association that does as much work in the legislature as the Texas Medical Association.